Hello, my name is Christina McGann, and today I will be discussing Zika virus in pregnancy. Here's just some facts about Zika virus. It's single-stranded RNA virus. It's spread via mosquito bite or unprotected sex with an infected person. Symptoms include rash, fever, joint and muscle pain, headache, and conjunctivitis. Diagnosis is based on travel symptoms and then confirmed by blood and urine tests. No current treatment or immunization against Zika virus. It's not common to be reinfected once you've already gotten it. It can be passed from pregnant woman to unborn child. Exposure in utero can cause a newborn to have congenital Zika syndrome, which includes microcephaly, decreased brain tissue, scarring to the back of the eyes, clubfoot, rigid movements. And microcephaly can also occur postnatally, so that the newborn would be born with a normal size head and then it wouldn't grow properly as the infant aged. Epidemiology is in the 1940s. It originated in Uganda. It was found in humans in 1952 in Uganda. It's originated from Africa and Asia, located in tropical and subtropical environments. And then in 2015 and 2016, the Asian strains spread to the Americas. And transmission is now known in 55 countries and territories. In 2015, there were 0 cases locally acquired Zika in the United States and 62 travel-associated cases. In 2016, that number jumped to 224 locally acquired cases and 4,944 travel-associated cases. 2017 showed a decrease to 7 cases locally and 445 travel-associated cases in the U.S. And 2022 was the last I saw data, and there were 0 cases of locally acquired Zika infection in the U.S. and 5 travel-associated cases. Transmission is mosquitoes, unprotected sex with infants, unprotected sex with infected persons, and then from mother to unborn child in utero. And there has been discussions both ways about it also being passed via blood transfusions and organ donation. The prevalence is mosquitoes transmit from the infected person or animal to the next person or animal, may have mild symptoms, so you're not aware that you have the Zika virus, and spread it that way. It can be misdiagnosed as dengue fever, or I'm not even going to try to say that, chikungunya virus infection. Global travel also helps spread the virus from areas of tropical and subtropical environments to other areas of the world where it had not been before. Maternal risks are many are even unaware that they have the infection. It rarely requires hospitalization. Symptoms include fever, rash, conjunctivitis, headache, joint and muscle pain, and they said there are cases of post-Zika virus patients getting Guillain-Barré syndrome. Fetal risks include microcephaly, neurological disorders, eye vision issues, congenital Zika syndrome, like I talked to you about before, which can give microcephaly, decreased brain tissue, scarring to the back of the eyes, clubfoot, rigid movements. Perinatal risks, congenital Zika virus infection, brain and eye defects in the fetus, unknown effects on the pregnancy. Zika virus infection can cause damage to the fetus at any gestational age. It's not only during like first trimester or third trimester. And every pregnant woman, they suggest, should be asked about Zika virus risk factors at each prenatal visit, and then whether or not to test them is based on the risk factors and any associated symptoms. Patient presentation subjective, myalgia, arthralgia, headache, raised red areas of skin. Objective, the maculopapular rash, conjunctivitis, low-grade fever. In many cases are completely asymptomatic. Fetal neonatal presentation is brain tissue deformities, abnormalities, including they can have a partially collapsed skull, microcephaly, increased muscle tone and rigidity, clubfoot. Differential diagnosis is dengue fever, that beautifully hard one to say. Group A, streptococcus, rubella, measles, parvovirus, enterovirus, and adenovirus. Diagnostics, you can use whole blood, serum, or plasma testing for Zika viral nucleic acids, the active virus, or immunoglobulin M that is Zika virus specific. Serum testing to rule out the ones that I previously talked about. And then lab confirmed cases need to be reported to the Center for Disease Control and Prevention via the ARBONET surveillance system online. Treatment plan is there's no pharmacological treatment of the actual viral infection. It's just treating the symptoms. So analgesics, antipyretics, IV fluids if you're dehydrated. And until you know for sure that it's Zika virus and not dengue fever, you do not want to give NSAIDs or aspirin, which we don't usually give in pregnancy anyway, due to Ray's syndrome and increased risk of hemorrhaging. Non-pharmacological treatment plan would be have the patient rest, increase fluid intake, offer the patient support, and protect them from further mosquito bites, as well as unprotected sex with others while infected to keep the spread of the virus down. Education needs to be how to protect, teaching the patient how to protect themselves from further mosquito bites, including covering, long pants, staying indoors, those kinds of things, to refrain from sex or to use prophylactics until after the infection is over so that you don't spread the disease. You need to follow up with maternal fetal medicine for fetal well-being, and as a provider, we need to educate them on the importance of following up, even though it's an extra doctor visit. It'll be vital for fetal well-being. Need to remain hydrated, and how to safely take antipyretics and analgesics to help with symptoms. Um, Follow up in fetal well-being. They say you can do an amniocentesis after 15 weeks based on clinical findings, but the information is kind of cloudy on whether or not it does any good if you find virus in the fluids and things, so it's up to like a clinical decision. Fetal ultrasound on diagnosis and then serial ultrasounds until delivery, approximately every 3 to 4 weeks should be done, and it may take 2 to 15 weeks for abnormalities to appear in the fetus. Ultrasounds are to detect anomalies and monitor fetal growth. Patients should be referred to maternal fetal medicine, as I already discussed, so they can be given all of these things. And these are the references. And then while I'm showing the references, I would just say if you're not pregnant, I would have them stop trying to become pregnant until after we know that they test negative for the virus. No more live viruses in their blood. They might still have the antibodies to it because their body made them, but no live virus should be present. And because we don't want them to get pregnant while they're still infected. Infections, signs and symptoms of infection can take 1 to 14 days. And then the infection is usually over within 7 days after that. So you would want to teach them to make sure that they're using protection to not become pregnant during that time period, and really want to just try to hit home the fact that they should try not to have any sex during that period, just to limit the chance of spreading the disease. Thank you.